All right, everyone. Thank you all for tuning in today. I have a very, very important message and just making sure everybody is watching. And I'm going to go ahead and get started. Thank you all. Thank you all for coming in. Thank y'all so much for watching. My name is Melissa D. Home, and I have a very important message to share with everyone that they want to take our healthcare away. This is what the shutdown, the government shutdown that we are in day 13 is all about. HR 247 is the bill. This bill would extend healthcare subsidies to make healthcare more affordable for over 27 million people in the United States of America. And for some reason, Congress doesn't want to do it. Now, they're going to try to fool us and tell us this is a red state versus blue state issue. And it's not. According to the Kaiser Family Foundation, they found that 78% bipartisan of Americans agree to extend these subsidies. That's across Democrats, Republicans, Independents, and MAGAs, Make America Great Again. They all agree that Congress needs to extend these healthcare subsidies to keep 24 million people covered. And this is independent research by the Kaiser Family Foundation. I want to make sure that you all understand that this is not an illegal immigrant issue that people have made you all believe. And believe it or not, okay, illegal immigrants cannot get health insurance from the marketplace. This is not a DEI issue. This is an American issue. You might be shocked to know that geographically, according to the Kaiser Family Foundation, 3 in 4 enrollees in the Affordable Care Act actually live in a state that Trump won in 2024. Part of it is due to the fact that southern states such as Georgia, Mississippi, Texas, Louisiana, West Virginia have seen triple the enrollment in the past 5 years in the Affordable Care Act marketplace. Listen, you all, this issue of the healthcare did not start recently with this thing and them taking away our healthcare. This has been going on all year long. It started with the passage of the One Big Beautiful Bill that cut Medicaid by $1 trillion. This led to stricter eligibility requirements in order to get Medicaid. All right. And the Congressional Budget Office estimates that over the next decade, 10 to 17 million people will become uninsured due to this. Not also including how many rural hospitals will be closed because their funding was cut by the One Big Beautiful Bill. You all, this is a humanitarian crisis that I am talking to you about today. The people who have lost their Medicaid, It has not just started, but it will not just start next year. It has already started. In DC, 25,000 people have lost their Medicaid coverage already this year due to the cuts of the One Big Beautiful Bill. Every day, I speak to seniors who attend a doctor regularly, wanting to know what happened to their Medicaid and being told that they can no longer get it and now they can't afford to go to the doctors anymore. This is not something that is waiting until next year or a decade down the line. This is affecting people now. This is not something to be left for the new administration to handle. Okay? This is something that needs to be handled now. I asked ChatGPT to tell me what are the effects on a society when a large portion of people are uninsured. There are many, but here are a few that I would like to share with you today. Number one is the spread of disease. And I'm not talking about COVID. Currently in the US, as little as it's spoken about in the media, we are in the middle of the resurgence of the measles because people are no longer being vaccinated. This is alarming because in the year 2000, measles was eradicated in the US. Okay? Currently, we have 1,543 cases of measles in the US compared to 30 cases over the past 30 years. And to add to this, these cases are spread over 41 states, and it is growing daily. Another effect of people losing health care and this bill not getting passed by Congress and them taking our health care away is that the healthcare system will be overwhelmed, more overwhelmed than it is now because people will no longer be able to afford to get regular checkups. And more hospitals will be closing due to them not getting paid. Number five, preventable deaths. Let's talk about it. When people do not have health care, they cannot treat common illnesses such as high blood pressure and diabetes that, if left untreated, could be deadly. People will literally die if this bill is not passed. And this is just to name a few. I'm going to ask you on watching this, when does it stop? When does it stop? Their strategy so far in America has been to divide us by color. At first it was black and white, now it's red and blue. Congress needs to pass this bill now. This is urgent. Open enrollment for the Affordable Care Act, it starts November 1st. Insurance carriers have submitted two rates, you all. This is emotional because people are really going through it. And something is not done here. Premiums, if this bill is not passed, is slated to go up 114% if these enhanced tax credits expire, according to the Kaiser Family Foundation. The Congressional Budget Office estimates that 4 million people will become uninsured when these premium tax credits expire. Many times, these people are small business owners, gig workers such as your Uber drivers, students, and the disabled. Republicans have made an argument that first the government opens and then they vote on it. But why should we trust this? These are the same people who did not want to pay our military, who was okay, but they're not getting paid on the 15th. You all, this deadline is nothing new to them. In February of this year, me and my colleagues of NABIP, the National Association of Brokers and Insurance Producers, we went to Washington and we lobbied on behalf of you out there for this bill to be passed. And I want to let you all know something. Every city official, every congressman, they have someone in their office who specializes in healthcare. They know exactly what is going on. And we met with many of them. So you heard what I said today, and you're probably asking, what can I do about it? Well, I'm going to tell you what you can do about it. You at home watching this, first thing, I want you to share this message. Because a lot of people don't know, a lot of people are fooled. A lot of people think it won't affect them. Okay? Next, what you can do is you can call your state representative. Call them first thing tomorrow morning. You can actually call the U.S. Capitol switchboard and they will connect you with their office. Because they want to hear from you, the constituent, and their voter, and you will their voters. Okay? They work for us. The phone number is 202-224-3121. And you can write this in the chat. You can call your congressman at the Capitol, and they will send you to their office. They are there. Okay, their office is open and they are taking calls. Now, that will be a group effort. The number again is 202-224-3121. We can all agree that something is not right in this country. A few weeks ago, we saw a man get slaughtered live in front of all of us, giving a speech at a college campus. Something's not right here in America. Lastly, I have to say this, that Congress not extending these tax credits is the biggest assault on eradicating the American middle class in the 20th century. And I will end with this. It is easier to control people when they are sick, poor, and separated. Thank you, and please share this message.